Is induced pain recommended when the lady does not get pain? There are 2-3 components for this question. It is a very difficult question to answer. सबसे पहले, the first thing is that how does the doctor calculate your pregnancy? कि we say that pregnancy is 40 weeks. तो ये 40 weeks कहाँ से calculate किए जाते हैं? So the 40 weeks are calculated by the doctor from the first day of your last menstrual period. That means last menstrual period में जब पहले दिन आपको period चालू हुआ, उस दिन से हम calculate करते हैं 40 weeks. But as you know, as all of you know, definitely you haven't conceived on the first day of the last menstrual period. You have conceived around 15 to 20 days of your menstrual period. But none of us know at the molecular level when exactly you have conceived. So we calculate the pregnancy from the first day of the last menstrual period, which is known by everybody. So it's a strong pillar. So definitely our 40 weeks, you are not going to deliver. If you ask me how many patients are going to deliver on the expected date of delivery, it's only 4%. You'll be shocked to know it's only 4% deliveries who deliver on the expected date which is given by the doctor. So a patient who is delivering first, that is a primigravida, has a tendency to go ahead of the expected date. And a multigravida has a tendency to deliver before her expected date. So what the book says, how much should we wait? The book says that after expected date of delivery, you at least can wait 7 to 10 days. Provided your baby is moving very nicely, that means you are counting the kicks properly, the fluid levels are completely normal, the umbilical Doppler is completely normal, and the NST. These are the 3 investigations which the doctor sees. If these 3 investigations are normal, we say that the pregnancy even may go ahead 7 to 10 days, nothing is going to happen. Now, if the patient is not still delivering after 7 to 10 days, then definitely it should be searched why the patient is not getting her regular normal labor ka pain. Now the question is, I gave this information because this is going to help you to take this decision of induced labor or not. Now if the patient is not getting pains even after 7 days of expected date, then the doctor suggests induction of labor. Now what induction of labor means? Now we are putting some drugs, some tablets into the vagina of the patient which would cause the patient to have pains. First of all, these pains are not natural pains. Second, there are ethics and there are clinical judgment when the patient should be induced. There is something which is called as the Bishop score. This Bishop score tells us what are the changes at the cervical level of the patient. It can be found on Google. What are the changes at the cervical level of the patient? And if the Bishop score is favorable, then and then only our induction is going to work. So if you need to induce the patient, first of all, you can leave the patient for 7 days at least above her expected date, provided all the investigations are normal. The induction of the patient should only be done if the Bishop score is favorable. If you are not following these 2 criteria, then the induction fails. And the third thing is, induced labor does not have that regular intervals of relaxation and pain which comes in normal labor. So these 3 things the patient has to consider and talk with the doctor, and then only this decision should be taken of induction.